websites are really great resources. I really like the Mosby guide. They just came out. I just got the new one finally, but this is the 2012 nursing drug reference. I like the one for the nurses because it has more detailed information than the regular ones did. Basically, I went to Barnes & Noble years ago and opened up all of the drug books to the same drug, Prozac or whatever, and looked at the information they gave and said, I like this one because this one gives me the information that I want as an herbalist working with clients on pharmaceuticals. So I can look up the drug and it'll give me, you know, the names, the different names of it. You can look it up in the index in the back. I mean, I would never memorize this book. It's great to have the resource. And then I usually will look at the action. What is it doing? And I'll write this down in my notes before the client even comes in. So let's see if I can find a good one here. Well, I should have had a page marked off, but we'll use Prozac because that's a pretty common one. I think that's probably the psych meds are sometimes trickier to switch off of if somebody's looking to do it, but let's see, Prozac. I apologize, I should have marked this page already. One of the tricky things about looking at this book is the index is so large because there are so many drugs. 539. So, Prozac. Yeah. So it'll say, what's its action? Inhibits the CNS neuron uptake of serotonin but not norepinephrine. So basically it is inhibiting central nervous system. It's a selective serotonin reuptake inhibitor. So it's increasing the serotonin in the blood, in the body, so that they're having more of that good mood. Most of us know this already. It'll also give me, hopefully in this one, it doesn't usually, oh here we go, pharmacokinetics. Not actually giving me that for this one, but for other, oh here we go. Metabolized in the liver, excreted in the urine, half-life. Sometimes the information will be here if it's in the gets cleared out to the cytochrome P450 pathway. That's important because those are the ones that St. John's wort is going to affect. The other thing that I'm going to look at is, so it's metabolized in the liver, excreted in the urine. I might be cautious if I have a client on Prozac. I'm probably not going to put them through a liver detox, or if they're, you know, especially if they really want to stay at certain levels of that drug. I don't want them clearing it out too quickly because they're taking that drug on purpose. So I usually won't do major liver cleanses. I won't put them on heavy doses of diuretics because I don't want to amplify or decrease that excretion process. So that's something I'm usually careful about. And then I'll also look at interactions. And when I'm looking at the interactions, and they've always got a lot of nice ones listed, and you know this one has even more. I'll look at, where is it here? Interaction. Well, this one has lots of them actually. But it talks about selective serotonin reuptake inhibitors. Well, they do list St. John's wort, but maybe if they didn't, I might still think, well, I know St. John's wort works kind of like a serotonin reuptake inhibitor, so even if they didn't list it, I might avoid that herb just to be cautious. I'll look at the other things that it's working on. So digoxin, okay, so no foxglove, but I don't recommend that anyway. Warfarin interacts with that, so I might be cautious with blood thinners, just to be careful. I'll look at the drugs and think what herbs might work like those drugs, and I'll usually avoid those even if they're not necessarily on the interaction list. This is me being overly cautious, but it's just how I prefer to do it. It does list, you know, that hops, kava, lavender, valerian, the sedatives, might increase the sedative properties of Prozac, which is kind of to be expected. Doesn't mean they could never take it, but you just would want to let that client be aware. If you're going to try to take valerian for sleeping and you're also taking this Prozac, you might want to try a low dose first, see how it acts. You might feel a little bit too groggy, so you can kind of give those cautions there. And, you know, but usually you'll find that there actually aren't that many herbs. There are some herbs that interact, but aren't that many. But I do really like to look to see what drugs could interact too, so that I can still kind of play that extra level of caution. I will also usually look up the side effects and cross-reference the side effects of the drugs that they're on with what their symptoms are. It doesn't happen often, but it does happen often enough that whatever drugs they're on are most likely causing their conditions that they're coming in to me for. So if that's the case, then I might talk to them how important is this? I'm not giving them recommendations on taking the drug, but I might say, how important is this pharmaceutical for you if it's causing this symptom? Is this the risk-benefit ratio Do you want to talk with your doctor to see about maybe switching to another drug or seeing if you still need to be on it or lessening it, because this might be the cause. And although I can potentially work on the symptoms with herbs, I'd really rather take away the cause if I can. Sometimes that's not possible. Like for instance, Prozac and a lot of the antidepressants tend to reduce libido. For most people, that's not enough reason to go off of the Prozac. It's keeping them happy and keeping them from wanting to kill themselves. So that's more important. But they might want a little bit of help in bed. So we've got herbs for that, and they're perfectly fine to use alongside Prozac. So you can definitely do that. I have had some clients who maybe wanted to switch, like I was saying before, where they're wanting to change off of things. In the case of, for example, we'll stick with the Prozac example, but which I think sometimes the mental health ones are the trickiest ones to switch off of. But you might start with giving therapeutic remedies that are very unlikely to interact, but can have similar effects. So food sometimes will fall into that role, helping to get somebody's diet for almost any ailment, getting somebody's diet and digestion in better place is usually going to be a good thing. Getting them to sleep better will almost always affect, beneficially affect whatever else they're going through. And then they might turn to things like omega-3s, fish oil, or eating fish, or taking a fish oil supplement. It's unlikely to interact, but it can have really great benefits on the mood. I might also turn to something like flower essences, which have really great effects on the mood as well as other aspects of the body, but they have almost no chance, if not, I wouldn't think they have any chance, but I'll never say never, but they have almost no chance of interacting with any medication. So they're a really great herbal modality to turn to if you're nervous about taking anything. Those food remedies can be really helpful. Homeopathics, I'm not really trained in homeopathics. I'm not super drawn into them, but they do have a lot of great uses, and they should be perfectly fine to use along with pharmaceuticals too. So you should be able to do that. So that's, those are nice ones to think of, especially if you're one of those people who's just afraid to touch the herbs with a 10-foot pole. Those are almost always safe no matter what's going on. So you start with those supportive therapies, and then if their doctor is willing to work with them to start lessening the dosage, you can try to bump in an herb that maybe has somewhat similar uses and kind of switch them off that way, but you need to have somebody who's willing to work and do that. I have had clients go off of heart medications, diabetes medications, other sorts of, a lot of hormone control, types of medications, migraine medications. I've had a lot of clients who've ultimately gone off most, if not all, of their pharmaceuticals and switched to herbs because they wanted to. I didn't force it on them, but that was one of the things that they were looking for, and they were able to do it without an issue. So it can be done.